Hi, my name is Erica Simpson. I'm a licensed massage therapist in Massachusetts and New Jersey, and I've been in Josh's care for about 9 months to a year.
Great. So, thank you for being here, Erica. So, I just want to first start out this conversation by asking you, just tell us a little bit more about your day and like what kind of challenges you face.
Yeah, for sure. So like I said, I'm a massage therapist. That's my day-to-day work. I'm also an actor, and both of those things are very physical. So when I am at my job, I'm not sitting usually. I'm using my body in a very dynamic way. I'm doing a lot of pushing and pulling at the same time. I'm also on my feet quite a bit. And though we work really hard to make sure that our body mechanics are good and positive, supporting our own health, a lot of times I prioritize my patients' comfort and care as opposed to how I feel. So as a hypermobile person, I also have a lot of laxity in the tissue right around my joints. So I feel very rolled forward. I feel very tight along my sternum. I sometimes have discomfort around my third or fourth rib area, which is connected to some old emotional trauma and postural issues from teenagerdom, kind of. And on top of that, I also spend a lot of time thinking about my breath. I've had a number of vocal injuries. I've been in voice therapy twice for nodules on my vocal cords, and I find a lot that I am oscillating between feeling very grounded and centered since I've been in Josh's care, and when I walk into the office, I'm usually I don't know, I feel like my feet aren't touching the ground correctly, and everything is just bad, but it's so subtly bad, but then therefore really overwhelming. Sometimes I don't even notice that I'm in so much discomfort until I allow myself to breathe on his table, because I'm so used to being the caregiver, as many people are, whether it's at your job or for your family.
Can you describe a bit about how the care is making a difference and how you function on the job and in your life in general?
Oh, for sure. So first things first, I've noticed, and this was crazy because I've done a lot of research about voice work and breath work as someone who's had some injuries and then has a demand on my voice where maybe if I was typing at a computer all day, I wouldn't have that concern. I noticed that my breath is very stuck. I don't breathe in a way where my diaphragm contracts and then my ribs kind of open, or they do it all together. Because of the hypermobility, things are very disjointed, and it's step A, step B, step C, step D, which isn't necessarily how it should be going, not to use judgment language. When I walk out of Josh's office, I feel like one person as opposed to a bunch of different Mr. Potato Head pieces that have been stuck onto an abdomen. And that allows me to go to my job and show up with strength and support, and then still feel energized at the end of my day. My clients can feel the difference in the strength that I can provide them and the support. They notice that my hands don't shake as much. I feel really sturdy when I've come from good work with Josh, and it flows over into other areas of my life. I also rock climb, and man, the times that I've had a really nice adjustment and then I go get on the wall, I can do things that would take me hours of prep to do on another day, and it's like a part of my warm-up. My body feels very in alignment with itself, and it feels, and I can tell it is communicating much better. Not just tissue to brain, but tissue to tissue. And therefore, my my body's ability to compensate for what I'm doing is that much greater, but I put compensate in quotes for a reason. There's less compensation because we've brought things back to a place where the body is supporting itself, and then I get to do things. On top of all of that, my care of my clients has changed so much. As my posture started to shift, and as I became more connected to my breath, which is a very strange thing in New York City because everything is so close together and psychologically you stop breathing. I started to discover my breath in New York City of all places, and then be able to bring that to my clients, and my cues for them on how to think about their posture, think about their bodies, and think about their progress have all shifted as a direct result of Josh's work. So his work is not just with his patients, it's also with the people that we interact with. It's spilling over that much more. The ripples go from the center of the lake right to the shore. And I have noticed their care pick up and speed up and become that much more targeted since I started my work with Josh, which has just been such a gift.
Thank you so much for being so open and sharing so much with us.
Always.
I just have one final question for you, which is, could you imagine what your life would look like had you not been under care?
Yeah, it's not good. The first thing that happens when I think about that, it's almost like I can feel my body wanting to go into the position that it would have been in. And that maybe that's an actor thing of like, oh, can you imagine? Yes, I can. And maybe it's more of just the reality of it, but I can tell and feel that I have more access to the small muscles or the less used muscle fibers that now are able to strengthen enough to hold me the way that I want to be held, the way that my spine and my entire skeleton wants to be aligned, because there are no longer impingements along the way. The nerve signal is able to get through to where it needs to be, and therefore I'm able to use and strengthen those muscles because my spine is more in alignment, because my humerus isn't rolled inside its socket. I can reach things that I couldn't reach before. I can check my blind spot in ways that I couldn't before. So it's almost like I would have to go through my whole day, from getting up in the morning and brushing my teeth to getting in the car or getting on the wall or putting my hands on a client. But each part of my day, there are specific and measurable differences in how I relate to my body because of the work with Josh, and not just how I relate to my body, but how I feel as a result. And it is, I've never not been in pain since I was 14, since seeing Josh. So I really couldn't recommend anyone else better. I've seen other chiropractors. I love chiropractic work. Josh is special. Do yourself a favor.